Okay, we are still with test and measures number 2, and now we are moving on to passive accessory intervertebral motion. So the first 2 techniques I'm going to show you are better suited for the cervical-thoracic junction, so that area, that upper thoracic, lower cervical area. Okay, so we're going to do a central PA spring test, okay, over spinous processes with that V contact with my thumbs. I'm going to palpate for C7, that prominent vertebra. Okay, so I'm just going to pick that one just because. I'm going to put my thumbs in a V on that C7 spinous process. Okay, my direction of force is going to be, it's a PA, but it's going to be in a little bit of a caudal direction. So you can see the that it would be in line with my forearms. Okay, I would be doing a posterior tipping or an extension of C7. I'm sorry, I said C7 on T1. So I'm going to take up the slack there, get to end range, and give a little spring test at end range. Okay, and I can do it there. I can move down a segment and do the same thing. Okay, again, I'm looking at extension. That one, he says, is...
hurts because you're pushing on the bones.
Yeah, well, normally pushing on bones doesn't really hurt.
Okay.
Sensitive child, the one that was... we say was born with extrasensory receptors. Ooh, look, they're having a stare down.
No, Theo is sleeping.
Is he?
The cat is...
Oh, maybe.
Yeah.
She's looking at him. Yeah. Okay, Stella does not always like Theo. Okay, so now I'm going to come to the side, and I'm going to look at rotation. Okay, don't be like totally on top here. You can see I'm on the side, so now my forearms are more in line, parallel to the floor, roughly, because I want to try and create rotation. So if I'm looking, let's go back to the C7 on T1. If I'm on the right side of the spinous process of C7, and I would be pushing towards his left, I would be creating right rotation of C7 on T1. So I'm going to use one thumb, this is my dummy thumb, and then I'm going to use the other one as the mobilizing thumb. And I'm going to take up the slack. I'm going to do a little spring into rotation of that C7 rotating to the right on T1. Okay, I can move up a segment or so. I can move down a segment or so. I know I'm telling you guys this is great for the cervical-thoracic junction, but I can do this if I wanted to all the way down his thoracic spine. Okay, and then I would come to the other side and do the same thing to look at left rotation. Okay, now moving on to techniques that are more geared towards the mid to lower thoracic spine. I'm going to do what you have on your slide, a central PA spring test via spinous processes. It's also it's a kind of a tipping, a posterior tipping and extension. Except now I'm going to use my pisiform, okay, that one of the carpal bones. It's a great thing to use for mobilization. This hand is monitoring paraspinal activity. I want to make sure, because I can't see his face, that as I'm doing this, that he's not contracting all of his muscles down here, perhaps because it hurts. Okay, so I'm going to start kind of upper. I'm going to pick like kind of T3, T4, put my pisiform on the spinous process of T3, and my forearm is in line with the direction of force. In this upper part of the thoracic spine, I want my force to be perpendicular to the curvature. So it's going to be more in a PA with a little bit of a caudal direction. More mid can be just a straight PA. And then this lower portion is also then more of a PA with a caudal slant to it. Okay, so I'm going to take up the slack. The other thing I want to say about this, when I do that spring test, I take up the slack, I get to the end, I give a little spring just to assess the springiness of that end feel, is that I'm not sitting here and pushing with my arm or using my pecs, right? I want it to be more of a weight shift and a shoulder blade depression, okay? So I want you guys to be thinking that it's shoulder blade depression. So my elbow is locked, I'm shifting my weight over my forearm and depressing through my shoulder blade, okay? And I can do this maneuver all the way down to the lower portion of his thoracic spine. The other thing I want to comment on, I chose to use my right hand on purpose because in general when I do these techniques, please stop moving. Thank you. I want my my forearm to be in the direction that I'm mobilizing. Okay. If I used my left hand, do you see now how I'm actually, it'd be more of a superior force instead of a caudal force? Or sorry, I should have said a cranial force instead of a caudal force. So in general, when you do these, you want your thumb aiming down towards the rear end of your patient. Okay. So that is for central tipping. Or posterior tipping or extension of the mid to lower thoracic spine. Now, I want to show you something else. This one is the next one on your list, and it is central PA spring test via the transverse processes, which creates a gapping. I want you to listen carefully. I'm going to show you all of this on a plastic spine, so don't freak out yet. It is a gapping of the inferior vertebra on the superior vertebra. Okay, I'll show you that on a plastic spine model. So this is one of those exceptions to the, you know, always talking about the superior on the inferior. What? I'm talking, so you don't need to look. You can raise it up. There you go. All right, you can see I have a different videographer today. This one is, probably should notice, is shorter. You can say hi if you want to.
Hello.
Good. I like how you did that slowly so that they didn't get nauseous.
Yeah, but I turned it around fast again.
That's okay. I think they'll forgive you. Okay. All right. Now, so index finger, middle finger. Okay. If let's say I'm roughly in the kind of T5-6 area. So let's say I want to be on T5. I know that from the rule of threes that spinous process is about a half-ish vertebral level below the transverse processes of that same vertebra. Okay, so I'm going to come up a little bit, what I judge to be about a half a segment, and I'm going to use my index and my middle finger over transverse processes. Okay, so can you come up? Can you see my fingers here? Good. Mm-hmm. I'm going to take the ulnar border of my other hand. These are kind of my dummy fingers. This is going to be my mobilizing force here. Okay, in a PA direction through the ulnar border of my hands, which goes, it's going to give a bilateral PA force down towards the table. Again, through a weight shift of my body and a shoulder depression. Okay, creates gapping of T5 from T4. Okay, I'll show you that on a plastic model. The other thing I want to note is, let's say I'm on T5. Okay, and I decide to take my middle finger and move it down a level. So my top finger is on the transverse process on the right of T5, and my middle finger is on the left transverse process of T6. And let's say I come back and with my ulnar border of my hand, and now I impart a posterior to anterior force. Because of what I'm going to call the rule of the bottom finger. The bottom finger is on the left side of him. It's going to create a left rotation of T5 on T6 if I put my fingers in this manner. So I'm on the right transverse process of T5, the left transverse process of T6. I would be creating a left rotation of T5 on T6 because this finger is on the bottom finger is on the left side. So that is the rule of the bottom finger. And then I can do this, my PA force. Now, let's say I did it the opposite. And so I'm back on T5, I'm on the left side of T5, and I'm going to come to the right side of T6. I would be creating a right rotation of T5 on T6. So it's just another cool way to look at rotation. If you don't understand what I just talked about, I'm going to show it to you on my plastic spine model. Okay. What else do I want to do? Okay. So, hold on a minute. I want to make sure that I don't mess this up. The cranial one is on the same. Right. Okay. Now, if Okay, now I want to do a unilateral PA spring test, okay, using my pisiform over the transverse processes, okay? So, yeah, that's what I want to do. Never mind, I was about to say something, okay? So what I'm going to do is this hand is going to be over the right side of a transverse process. So let's say that I'm back to kind of T5, T6 area. Okay, I'm going to locate that. That's T5 spinous process. I'm going to be about here. I'm going to do pisiform pressure. Okay. Actually, I'm going to do it this way. Never mind. I want to be consistent with the picture here because you can do it both ways, whichever hand I use. I'm going to be mobilizing on the side that I'm on, okay? So I'm going to be on the transverse process with my pisiform over here, and I'm going to want to impart a PA force to that transverse process, except that I've decided I want to have a little bit of stabilization. And so I'm going to come to the other side of that level and try and block the rib that corresponds to that vertebra. So I'm over the T5 rib, and it's probably tender because your muscles are tender. Because if I just do a PA force this way, it's going to cause left rotation because I'm on the right transverse process, but the vertebra and the rib are going to likely the rib is going to rotate as well. So I'm going to block the rib on the opposite side just as an attempt to stabilize and localize this force more towards the vertebra. So this one is stabilizing the opposite rib. This hand, pisiform, PA force, spring test on the right side of T5 on the transverse process, which is going to create left rotation of T5 on T6. Okay? Now, the next slide that you guys have, instead of using pisiform, I can use my double thumb contact on the transverse process of T5 and just impart a PA force. Okay? If I'm on the right transverse process, going to create left rotation, but I'm not stabilizing the rib. Okay? But I can work on this rotation ability really all the way from kind of that cervicothoracic junction all the way down to the bottom. And then I could come around to the other side and do PA spring tests on the transverse processes on the left side of him, which would create right rotation. Okay? Now, so that is akin to a UPA or a unilateral PA, but not as Maitland intended. Maitland did his UPA forces over facet joints. So if I wanted to make this more of a classical Maitland UPA, I would be in between the spinous processes and the transverse processes. In between, theoretically, I'd be over the facet joints, so I could do my PA forces there, okay? I'm not going to make any comments as to whether that causes rotation or anything, because we know with the Maitland UPAs, he's not really talking about arthrokinematics. It has more to do with provocation of dysfunctional segments, okay? So you can do the UPAs over the transverse process and talk about rotation, or you can do UPAs over the facet joints and be a little bit more interested on identifying dysfunctional levels and what effect it has on the patient's symptoms. Okay, so hopefully that makes some sense. Okay, now, one thing I want to do a little bit more of, I'm actually going to skip 2 slides ahead. I want you to go to the one that says unilateral PA spring of the ribs, and it has ribs on top. So not the slide that has the 4 pictures on it. Okay. If I want to see how his ribs are moving, okay, and ideally this is going to work better below the level of his shoulder blade. What's the matter? Okay. Because it's hard to palpate the ribs here between the spine and his scapula, although I can. So I can do this technique up here if I want to, but I'm just, for ease of seeing it, I'm going to move down a little bit lower so I can feel the lower part of his rib cage over here. So if I wanted to assess the ability of the ribs on his opposite side here, so on his left, to sort of to do a PA spring over the ribs and really kind of distract that rib away from the transverse process. Okay, remember the costotransverse joint. I am going to have my ulnar border sort of in the direction of these ribs. Okay, I'm going to pick a rib to start on. I'm going to be on the opposite side of the vertebra that rib attaches to, and I'm going to block it by providing a stabilizing force over the transverse process of that vertebra. Because if I don't do that, and then I give a posterior to anterior with a little bit of a lateral slant to this rib, that whole vertebra is going to rotate with it. So if I block the transverse process, I'm in a sense blocking that transverse process, blocking that vertebra from rotating. So I'm going to use my pisiform process here. Can they see everything? Thank you. I'm going to be here with my pisiform. Make sure you're on the same level here. Okay, stabilizing, and then through a weight shift and a scapular depression, I'm doing a PA force spring test to the rib, and then I can keep kind of moving down and looking at successive ribs, and then I would do the same thing on the other side. Okay, now I'm just going to keep him on his stomach here because I want to get a different sense of how these ribs are moving. Ethan, I want you to take a deep breath in for me. Good, and out. Okay, and we're going to do that again. Hopefully through the video you can see my hands are expanding. I expect posterior and lateral expansion, that bucket handle motion. Now let's just say I felt like, you know what? Oh, he's ticklish. I forgot. Sorry. That over here I wasn't feeling expansion. I could be very specific if I wanted to and feel, oh, come on. It's not that ticklish. Stop. Okay. I won't actually do it to him, but you guys are going to imagine there's a rib here. That is a rib. Would you stop?
God, why?
All right, I gotta figure. You guys are gonna have patients who are ticklish. You can, when I'm talking,
All right,
like show
I'm
me.
good, I'm good.
Doesn't have to be always down there. Okay, so now show the rib again. So let's just pretend that this finger here is a rib. And I felt like when he breathed in, I wasn't feeling this lateral expansion. I could come with a finger and palpate underneath the rib and spring test superiorly under. Can you see what I'm doing? Under the ribs to assess that upward movement for inhalation, and then I could come above, okay, I'm gonna be a different rib here, okay, and look at rib depression and spring test this way over, I'd be on the superior border of the ribs. So he's ticklish, but I can spring test them from above and down, so that would be for exhalation or rib depression. Or I could come underneath and spring test superiorly. If through my more global assessment, I felt like there was a certain area that wasn't elevating and depressing. Okay, so here it's easiest to do this posterior, lower kind of half in a prone position, but now I'm going to turn him on his back. And I'm going to put the face hole back with my cat-eaten face hole plug. And the cat's in my chair, so I'm gonna stay standing, although I probably should be sitting.
Okay.
That's okay. I'll be here on my I'm good. Okay, so now what I can do is if you feel like you're way close, thank you. So make sure you can see where my hands are. So I'm here on the anterior superior part of his rib cage. So here, remember, is the pump handle. So I'm gonna have him take a deep breath in. Good. I'm just feeling for symmetry of motion. Okay. If it feels pretty good. But if it didn't, and I felt like, let's say that I wasn't feeling these ribs over here on this right side elevating, then I could come underneath those ribs. Okay. And I could individually spring test them in a superior direction using my thumbs. Like this. Okay. So these ribs, remember up here, they don't get really sloped until we get down to this area. My super
Ticklish area.
tickly boy. Okay, so I can individually spring them upwards, and I can also individually spring them down. And then I can do the same thing here on the front. So breathe in, good, and breathe out. Really common here in this lower part of the rib cage that these ribs sometimes have trouble with exhalation, and so you'll see somebody with a really prominent costal arch here. And so I might come here and do some individual spring testing along I'd be tracing the ribs here.
I'm really trying.
You're doing a great job. I'm just gonna pretend here. So here are his ribs, and I can be on the superior border of the ribs and do little spring tests down to try and find and localize those areas of restriction. So you guys get the point. So I'm here, I come here, I'm more posterior and lateral. I did that already when he was on his stomach. And then for the last part of it, actually I lied, there's two more things. Can you see what I'm doing here, Luke? Or do you need to come on the other side? Can you see my thumb? You want to come on this side? And I'll do it over here. All right. Smooth moving. Don't make my students sick. Good job. Okay, you don't have to be like too...
But then I can't see your thumb.
All right, come over here. But it needs to be more from above. There you go. No, not above. Above my head.
Above your head.
Oh, literally. Oh, all right, I just need to look and see how close you are. Like that. That's good.
Right.
Okay, so you guys already know how to palpate the first rib because we talked about it in the cervical spine, but I'm going to use my thumb. I'm going to kind of move that upper trap back and out of the way. I'm about halfway between kind of the C7 spinous process and the acromion. I move the upper trap out of the way, sensitive boy, and then I'm going to I'm going to let my thumb sort of sink into that tissue or through the tissue in a direction that's kind of generally towards his opposite ASIS until I get a sense of a bone underneath my thumbs. This takes practice, okay? But I want you to start practicing it on people, okay? So now I'm on the first rib, so I can spring test it that way. Tends to be a tender area, but I can do a spring test on that. You only flinched once I told you it might be tender.
No, I thought it'd be tender. It's not.
Then why did you
I don't
wince
know.
at me? Yeah, see, it was funny. Okay. The other thing I could do is, nope, I'm going to leave it at that. We'll talk about treatment later. Sternocostal joints. Remember, those ribs come all the way anterior and attach to the, say it again.
Sternum.
The sternum. He's so smart. He's been
It's a
listening.
basic bone.
A basic bone.
I don't know.
Okay. I want you to practice palpating where those ribs come and attach to the sternum at that sternocostal joint, and you can kind of feel the joint and where it there. You can feel the distal aspect of the rib, and then I'm going to do a PA spring test. Okay, dummy thumb, mobilizing thumb, anterior to posterior direction. So these are AP forces at the sternocostal joints. Okay, they need to be able to move too when your ribs move, okay? And I can do this on both sides, okay? Obviously down to about rib 7. Remember, the ribs underneath come and attach to the rib below, but you're looking at all these sternocostal joints on each side of the sternum, okay? Tend to be tender in females more frequently than in men. We're not going to talk about the reasons why.
I think I know.
I don't think you want to tell them, do you?
Nope.
Okay, good. Good choice, Ethan. All right, I think that does it for passive accessory motion for the thoracic spine. Again, if you're confused, like the whole rule of the bottom finger, I know that confuses people. I'm going to show it to you on a plastic spine, so don't worry, it's coming. And that is it.